Now the pressure's on. Thank you.
Only audio.
Okay, so first off, thank you for everybody being here on HTS side. That's great. So we're getting ready to go through our second Chap accreditation survey. So we're accredited, so it's like, as they define it, you have state things that you have to follow, you have federal regulations, we have accreditation levels that are higher than all of those levels put together that we have to follow and maintain. With that being said, I just want to I'm going to try to keep it as quick as possible, hopefully an hour, to go through everything that we're going to be going through. So she can be walking in the door, or he, they'll probably be a lady, any day, and when they come here, we have a whole stack of stuff we have to hand them right off the bat. We have to give them a copy of the schedules. I don't know how to print off HTS schedule for the next couple days. But they're going to come and they're going to go on visits, and they're just going to say, I'm going to want to go with this person, that person, this, and then I take them on those visits. So if you're seeing therapy visits in the evening, we'll be coming with you. So you're going to have to let me know what time. If you get a call from me, just be prepared. Anytime in the next couple months, if I call and say, hey, I need to go with you to your visit, do not go to that visit until I'm with you, because they have to be present.
Excuse me, but could you tell us who you are first?
Sure. I'm Denise. I'm the administrator here at Care at Home.
Denise?
Denise.
Okay.
Okay. So documentation by our policy is within 48 hours. And if it's just a simple note, it needs to be done that day of the visit. You guys' charting has to comply with our policies, so I think you guys are pretty good at having yours in probably the day of most of the time. Summaries, DC summaries, I think would be the one that might linger a little bit, but when they ask for those reports, I was going to pull up a laptop. Do you have your laptop here? So on our charting side, when they say, I want to see this note, and they say, I want to see the electronic details of this note, we can go in, we have to click on the details, and it'll tell you every single step that's been made inside that note, what time, what date, who did it, and when it was closed, so they can see if the note was turned in on time or not turned in on time. I don't know how to get to that on yours. So if you can check with somebody on that end, because if they ask for that, I have to give them that information, so that they can verify when the documentation is done and by who. Also in Iowa, we do what's called home health value-based purchasing. Everybody that works here has kind of heard it over and over and over again. And with that, home health value-based purchasing is how we get paid. Stuff off the wall here. And it goes off of a couple of things. It goes off the data that we submit on our OASIS assessments, so our every 60-day assessments that the nurses are completing. That data gets pulled over. They also take the data from our HCAP surveys, and these are surveys that patients get asked, so I want you guys to hear what these questions are, so you know when it's kind of like your Press Ganey scores from the hospital. You leave the hospital, they send you a survey, they want to know how you did. These are the questions home health patients are getting asked. How would you rate the agency on a scale from 0 to 10? If it's not a 9 or a 10, we're in trouble, basically. They want you to be a 9 or 10. Would you recommend the agency to care for somebody else? Yes or no? And then it goes to the care of the patient. Do the providers inform you about your care? Are you treated as gently as possible? Are you treated with courtesy and respect? Do you have any problems with the care provided? And then they talk about communication. Are you informed on the care and your services? Are you informed on arrival time? Hence that call the day before, let them know what time you're going to be there. I always say give them an hour. Like say I'll be there between 5 and 6 or 5 and 7. These people are going to be homebound. Unless they have a doctor's appointment, they should be there. They should be home. Are they easy to understand? Do they listen to you carefully? Do you get help or advice when needed? Do you get a timely response to get help from the office? Has anybody discussed home health safety setup with you? Has anybody discussed prescription medications with you? Has anybody asked to see the medications you're taking? Do they talk to you about your pain? Do they discuss the purpose of your medications with you? Do they tell you when to take your medicines, and do they go over the side effects of your medicines? Those are all the questions that the patients get asked. They do surveys every month. We pay a company to do this for us. It's mandated by CMS that we have this done. So those are the questions that are being asked. Our annual report, we're sitting at 80% on our rating our agency a 9 or a 10. So 80% of our patients would say we're a 9 or a 10. providers informed about our care, or we're at 60%. So this is not just, this goes from home health aides, homemakers, nurses, therapy, all the way across the board. This is all of our patients' caregivers.
So we're all supposed to be checking on their medicine and?
No, only if it applies to you. But they are going to ask them, you know, and they're gonna use you as an example when they say, "Are you informed about your care?" Do they call ahead? And you don't call, but our nurses do, or our nurse doesn't and you do. They're gonna say, "Well, some do, some don't." That's a no. So every single answer, and these scores get based on our payment. So if I don't get paid, I can't pay Heather. Heather can't pay you. That's how that rolls down.
Who's the Chap survey, or what does it stand for?
Chap, I don't remember what Chap stands for. It's the accrediting company for home health. I'd have to look it up. It's like Jake. Nope. It's not Medicare. Chap is an accrediting company, just like your hospitals are accredited, other places are accredited. We're a home health company that's accredited. You don't have to be for home health. We are. We paid a lot of money and spent a lot of time to get there, and I'm not about to let it lapse. So. And then with the home health value-based purchasing, like I was talking about, all of these things go into, and they roll it into some horrible, god-awful formula to come out with an achievement points and your threshold scores. And this comes from, those surveys are OASIS data. So when Heather asks you guys for your case conference information on how the patient's doing, how they've improved, your charting also needs to follow that, because when we get audited on our charting, it doesn't go to Heather, it comes to me. So then I read through all the charting, and I don't read a lot of your therapy notes because some of your abbreviations I don't understand. And if they ever ask me what it says, I'm going to be like, I have no clue, Heather. But your guys' charting needs to show progression, that they're getting better, or if they're not getting better, we need to get them off. I think Heather's pretty good at keeping on top of that.
And that's why that objective section, there should never ever be a note where there isn't a huge objective section. That objective section is what shows your progress from each note. He did 15 reps this visit. Well, this next visit he only did 10. Why did he only do 10? Could he tolerate it better? Could he tolerate it less? Every single note, it has to be that way. Our documentation has to be detailed, because if we don't have that to back it up, they will deny it. And it's going to come back out of somebody's pocket. So that's why I'm anal retentive about documentation.
So I'll tell you, so we get audits all the time, every week, from United Healthcare patients. Medicare, we get 5 a year on average. This year they're hitting everybody really good. And if you had any on the first 5 that you had to refile, we got paid 4 out of 5, which is pretty good. However, on primary, we got paid 1 out of 5, and we had to resubmit the other 4 and got paid 3 out of those 4, which is pretty good. However, they see it as your initial 1 out of 5, so that's what they count. One of those rejections was because therapy wrote one sentence in there, one sentence. Patient went to grandson's football game. Whole entire cert period denied. You're looking at $8,000 because of one sentence that a therapist wrote. One sentence. So that's how important your charting is. They're homebound. That means it's a difficult and a taxing effort to get out of their home. You need to, if they get out and they tell you about it, how many days did it take them to recoup? How many feet do they walk before they're short of breath? How many stops do they have? You need to chart, and if they don't have any problems getting out, they don't need to be on home health. We got to get them off. But if they do get out and you see them coming up the drive and they just got home from a doctor's appointment and it takes them 10 minutes to recover to get their pulse ox back up to 96%, you need to be documenting that, because that's what's going to keep us getting paid, which keeps you getting paid. So like I said, every chart that gets audited, they will pick one sentence, one statement, one checkbox to deny an entire claim. And it's getting worse as all of our patients get, we have a higher level of Medicare patients across the board, more and more every day. Our baby boomers are hitting that age, so they're looking for ways to make sure that they have money still, which means taking it away from us that are doing cares if we're not documenting properly. So you have to document. And it's not paint the prettiest picture possible. You know, you need to be maintaining and saying, if the patient, you know, whatever, if they're doing great, discharge them. If they're not doing great, you need to be saying why they're not doing great and what those problems are. Heather, do you have anything else to add to that?
just, and I'll send out that, what that surveyor had said about our notes again and commented on those notes because, and, you know, if you go through the CMS guidelines, it says the exact same thing that that person said to us. It's CMS guidelines require that you document all that stuff, or it's not a skilled note. So that's why I'm absurdly over preparing on notes, but it's necessary.
Any questions about any of that? The detail, or like on a note. Okay, so I'm gonna kind of run through a list of. We watched a video on when our survey comes up. Like I said, it's been 3 years since we did our survey. We had 5 deficiencies, and I was really unhappy. The lady couldn't understand why I was so unhappy because the average is 20. We had 5. So one of those is bag technique. Stacy is going to be a guinea pig and come up here and show you proper bag technique. Do you guys take? I know our staff does. Do you guys take blood pressure cuffs, thermometers, pulse ox, anything into the home? Do you have wipes to clean those with, and gloves? Okay. So a bag that you keep them in, it all has to be separate. So I'm going to have Stacy show you. Literally, anytime you go from one service to another, you better be washing your hands or using a hand sanitizer, or you're going to get us written up for improper bag technique and infection control. And we've already had it 1. I don't want 2 in a row. Okay. So we'll go over that here in just a minute after she gets that found on the computer. TB exposure, our policy and procedure on TB exposure, everybody has to have a baseline TB when you get hired. We fill out a TB questionnaire, and I'm probably going to have your staff do that one also. Or you need to probably have them do it on that end every year, otherwise you're going to have to go get a TB every year. Do you guys get your TB every year? Yeah. Some of you do, some of you don't.
Ours, the last we were told it wasn't required,
Right.
They do a 2-step, and that's good for 10 years.
Right. So ours, we don't have to do a 2-step, we have to do one on hire, and you can do a 2-step if it's positive or a chest x-ray. But if you guys are exposed to TB, you need to report that right away, or if you have signs and symptoms of TB. So our staff goes and does a TB exposure checklist every year. Do you have this? Do you have this? Do you have this? If it's all no, then you don't have to get retested. If there's any yeses in there, then you have to go either get another man 2 or a chest x-ray if you have a positive man 2. So remind me and I'll get you that. You guys are contracted employees, so it's a little different as to how much I have to maintain, but I still have to maintain employee files on each of you guys, as well as all of our staff, so it's a handful some days. There's a pile of them on my desk right now. A Medical Device Act. Do you guys all know what the Medical Device Act is with CMS? Okay, so that's not the right answer. So, Medical Device Act is any equipment that you have, and we don't have a whole lot of equipment here in home health. However, we still have to follow these rules. On the Medical Device Act, if you have a blood pressure cuff that breaks, you have to fill out a form that says that you had equipment malfunction. Did the patient get hurt? This gets sent to our director. She has to follow up on it to see what happened. And literally, we don't use, if the pulse ox doesn't work, it just doesn't work. But if a stethoscope the metal would break and pop somebody in the eye or face, then, you need to fill out this form. You need to bring the equipment in. It has to be inspected. We have to say what we did. Also have to fill out an incident report about that happened. So if they ask you about your equipment malfunction log, yes, we have one. It's right over down that shelf with all those other policies and procedures. If during your home visit they ask you about, well, what's Care Home's policy on hand washing? If you don't know the exact 9-page policy by heart, then what you say is, we have a policy on that. I'd have to check my policy and procedure manual to tell you the exact policy. And that is an okay answer. Policy and procedure manual is always over there on that bookshelf, and it's like 600 pages long. So, but anyway, they aren't going to ask you a whole lot in the home. These people up here are probably going to get hit with more of the policies and procedures. But in the home, they're going to be watching your hand washing, your technique. There's a couple questions they're going to ask the patient. First off, they're going to introduce themselves. They have a form that the patient has to sign saying it's okay that they come in and ask them questions. If they say no, she has to leave. If they say yes, they sign the form, and she asks them, do you know how to get a hold of your nurse or your therapist? And they will say no.
Of course.
But remind your patients on any of your home health people, they should have a folder in their home, whatever color it is. Ours are blue. On the front of that folder has our phone number. Our nurses are supposed to be hanging up a form on the fridge about call us first and the phone number there. So they always remind them of how to get a hold of us. Call the office number, somebody answers it 24/7. They have to know that on any survey, no matter what company you guys are working for. So if you answer that wrong, you're going to get the whole company in trouble.
Just because they call in all the time does not mean that they know how to get a hold of us when asked by the surveyor.
Because I had one of them tell me no. I'm like, you just called me last night. So they're going to ask them, are you happy with the services and cares you're provided? And if they say no, they're going to say why. Why not? What's wrong? Do you have any complaints? Does everybody treat you well? There was one other one. What was the fifth question she'd always ask? But anyway, she's not going to stay and watch you do a whole visit. It's literally, we'll be there about 10 minutes. She's going to ask them these questions. She's going to make sure that you wash your hands and that you get your patient up and that they're well cared for and that you're following proper procedures, and then we're on to the next home. They won't watch any personal cares with home health aides. She'll be in, ask these questions. If you are doing something with your bag, like you're going to take vitals, she is going to watch you. Again, that's why we practice our bag techniques every single month here, to make sure that everybody does it right. And for another, we don't want infections. Our infection control is like great. So Stacy has pulled up on the computer right here, so you can see this whole list on this computer screen right there. That's logging every single time somebody saves something on a visit note. So if the visit note was supposed to be turned in on the 5th and this is all charted on the 8th, they're going to be like, really? 3 days late? We will be written up for that. So that's what I'm talking about. A lot of them, especially you guys, don't know that all that's there, but every single time you guys log in, it tells me that you logged in. It tells me what time you logged in, whether it was on your phone or on a computer, and what time you logged out. That's our charting system. You guys use a different charting system that we pull from yours. So blue folders in the homes. It is required that we give those patients those blue folders. Inside that blue folder, have any of you guys ever looked in the blue folder? Okay, so it's patients' rights and responsibilities, why we can transfer and discharge, advanced directives, home safety, homebound. There's a whole bunch of information in there. However, on top of that information, there has to be a plan of care for every discipline that's there. So if you guys are giving physical therapy, you need to be putting a physical therapy plan of care in that chart. We're taking them also because I'm making the nurses print them off. But technically it's your guys' responsibility because you're the discipline supplying the care. But we're the ones that are going to get in trouble, so I make sure my staff gets it there. And if it's not there, you can let Heather know, and I'll pass it on to my nurse that it needs to be getting there. So they'll have a medication list to tell you every medicine that they're on. They'll have a plan of care for a nurse, at least, because they're going to have a nurse if they're having you guys. Your plans of cares, for whatever you guys are giving, they have a home health aide, that plan of care, homemaker, that plan of care. Did I miss anything? Oh, and a calendar. So inside that, yeah, that's not mandatory. That's us. Yeah. So the calendar that's in there, you guys have to write on that calendar when your visits are, when your next visits are going to be. And if
I usually print their schedule out and put it in there.
We print ours, but if you look at it at the visit and know your visit, it's not what it is on there anymore, you have to write on that calendar and change it.
Yep. So make sure your calendars are up to date because they're going to take it. They'll say, can I have this? And they'll take it out of the home and I'll have to go put a new one in. They're going to bring it back here and compare that to your documentation. If it doesn't match, we're in trouble.
When we do our notes, and I write it up plan of care, that's the goals and what we're doing. They're going to get 7 pages plus the exercises plus a calendar of its schedules. So we're supposed to have the PTAs type it or print out that on their own home computer and bring it. That's a lot of printing for the PTAs. It's like a lot. It's like, I mean, the form I think when you print it out, it's about 7 pages.
Yes. Yeah. The plan of care is only 2 or 3 pages.
Plus exercise plus.
And again, if you would,
therapy is fine.
yeah, but we have been printing all of those, but or trying to, but technically it's your responsibility to make sure it gets to that folder. So I don't know what other home health companies do. I know you guys work for more than just us, but that has to be in there. That has to be part of it.
Yeah, a lot of times they would be incomprehensible to most people.
Right,
It doesn't matter. It's the patient's right to be informed of the cares that are provided to them. And if you don't provide that, I'm in trouble. Even though they can't read our plan of care half the time, they don't read it. You have to have it in there. It has to be part of that folder at their house. Because they're entitled to know the service they're getting, what's being provided, and when. So the calendar went into effect, last year for the calendars. That was a new thing that they added, but it has to be filled out. So same way with home health aides. If you guys are going and the visits aren't scheduled out on that calendar, you have to write on that calendar, HHA, Monday, Thursday, Monday, Wednesday, Friday, whatever. It has to be written on that calendar. Nurses, you have to be writing in when you're going there for visits. Skilled nurse, skilled nurse, skilled nurse. And if you're going every Wednesday, write it down every Wednesday. If you didn't go that Wednesday and you went a Tuesday, you need to be crossing it off and putting it to where it needs to be. So it's just every visit you're there, you should be inside that blue folder. And then while you're there, you make sure plans of cares are updated, the right dates are there, the right med lists are there, and patients will take those out of there and take them to their doctor's appointment, and they never come back. So when that happens, if everybody checks every visit, we make sure that they're in there. This, like I said, this Chap survey is only every 3 years. Medicare can come anytime they want, Medicaid can come anytime they want, and it just always needs to be there. We try hard to keep them up to date. We find them not up to date, but they need to be in the homes and up to date. So if everybody's checking, we should have everything there. All right, Stacy, you want to do a bag technique demonstration?
If everything's not in there, who do you contact? The nurse
Yep.
that person's here?
That'd be great. You can call the office here and tell us if you want, and then Steph will get it printed out for the
I
next
don't know
visit.
what all of you guys see our patients, but I know some of you some of the patients I've seen just blank pages that have stick figures drawn on them to show them how to do those exercises. If they're just loose on the table or something, I usually put them in that blue folder. That way when I'm there after I give them their bath, I know what exercises I need to do with them. So if you get there and you're like, well, where'd this paper go that I took so much drawing these stick figures on? It's in the blue folder. Just so.
Yeah, I see them once and then I don't see them for at least 10 days. And then maybe not until the 30th day or something, so that's why.
I just know there's a couple houses that have those sheets that someone has drawn up for them, and I just stick them in the folder so I can find them.
Okay.
Okay. So your bags are never to be put on a dirty surface, the floor, a soft surface. Always try to find a clean, hard surface. If you can't find one, we've hung them on door handles. If you're going into a really icky house, take the stuff out, shove it in your pockets, make sure you're washing it off when you get back to your car. I always keep my hand sanitizer on the outside of my bag. Anytime you get into your bag, you need to use hand sanitizer or wash your hands. If you take your stuff out, lay it down, you touch something else, and you get back in here, we're going to get in trouble. So anytime you're reaching in, if I go into a home and I need to wipe off, I use my hand sanitizer. I'll pull out my my wipes, pull one out, wipe the table down, set my bag down. This stays out until I'm completely done. I'll use sanitizer again, and I pull everything out that I need so that I don't have to go back in there. Use your equipment, wipe everything off with this before it goes back in the bag, and I will take one and even wipe my canister off and put it back in.
So in our policy, there's a couple things that we have: disposable washcloths. If you guys need some, let me know. I'll get you some. You can lay down, if there's a soft surface, you can lay that down, or you can take a newspaper in and lay it down between your bag and whatever surface you're putting your supplies on. So I don't know, like I said, I don't know if you guys have blood pressure cuffs and everything you take in a bag, but if you do, it's got to be on a clean surface, and your hands have to be washed every time before you go to get in that bag. So say you did all your vitals and you're writing it down on whatever piece of paper, and you go to reach back into your bag to grab something you forgot, that's a breath and infection control, and now we're wrote up. She'll watch she'll probably go on 10 home visits, and it'll be, like 8 out of 10, 9 out of 10, but anything that we get wrong is a write-up that I get to write 20 pages on how we're going to correct it over the next 3 years. But yes.
At each time, it's
Each-
a different, right?
Yeah. Yep. So we also have to do an emergency preparedness plan. We have a disaster drill twice a year. We have a disaster plan. It's over there on that shelf as well. And you know what? I do not have HGS on our phone tree. I probably should update that. I'm probably going to have one call to Heather, and Heather will direct the rest of the calls to you guys. But you're contracted, so it's not quite as severe. You guys aren't going to really have to respond to anything we have, but I will have to notify you, then however you notify your staff. Just so that you know that if they ask you, where's your disaster plan for care home or whatever, we may have one.
It's changed anyway because of April.
Yeah. So, edit pages on our charting. This is for more of the staff over here. You guys can ignore all this for a minute. So on the edit pages, nurses, you have to fill out every single section on that edit page. Your contact has to have, if it says your emergency contact is going to go to your emergency contact address. It's the same address as the patient. How are you going to evacuate to the same address the patient has? You cannot use an emergency address as their husband or somebody that lives with them. You have to put in another address where they're going to go. If they don't have an address, then there's a comment box. You need to put in that comment box, no family, whatever. Patient needs to be reported to the local emergency preparedness department so that they know that they're going to be helping plan an emergency. You have to document it.
We've had some patients say, well, I'll just go stay in a hotel.
Document it.
You need to put that in your comment box, that patient reports will go to a hotel if unable to remain at home.
Okay. But it has to be documented. Remember, if it's not documented, it's not done. You got to document it. So like I said, the entire edit page has got to be filled out. Our policy and procedure went over that. Post-admit papers to the home. So everybody knows what the COPs are with Medicare, right? Conditions of participation. It's a book about this thick that tells you all the stuff that you have to do to maintain your Medicare eligibility and all the rules you get to follow. With those, all those changed January 13th, and they added on another whole set of rules that you have to follow. And with that is the rights and responsibilities that are in that blue folder of the patients. So when the nurse goes to admit the patient, they go over all the rights and responsibilities and read that entire admit packet to the patient. The second skilled visit, I don't care if it's PT, OT, skilled nurse, whoever it is, you have to go over those rights again with that patient. And you have to document it.
That's why we are doing it at every eval.
But
Because who knows if we don't, there's no way to coordinate who is the second visit, and I'd rather everybody do it, that way we know it's not missed.
Yep. So, but again, just because it's on your note, you have to actually do it and follow through, and they're going to ask them, and patients, there's questions on that survey that they'll ask about their rights, and some of them are like, no, I don't know anything. I'm just like, we know we've talked about them, we know they know them. Medicare decided that on admit there is too much information day 1. That's why by day 4 you have to, the second visit within 4 days, you have to redo it again. So you need to pull out that blue folder. Let's review your rights and responsibilities. Do you have any questions about this? Why we can transfer, why we can discharge, it's all in there. I'm not saying read the whole entire packet to them, but at least go over it and review it and let them know where to find that information. That's going to be skilled nurses, PT and OT's responsibilities, not your PTA and OTAs, because you guys are going to be after that second skilled visit. But it'd be your PT and OT evals. And then we also have to mail a patient representative another section of that same thing again within 4 days. So, dress code. This is do you guys have badges?
Yes.
Okay. Badges have to be worn at all times. So, if you walk into my office, I'm like, "Where's your badge?" But if they walk in,
Do you have your check?
did you check your box?
I have a box.
Remember? So, anyway, badges have to be on
Chelsea
and
has a new
present.
one. Oh, you got it.
Yep. Yes. Did you check the box?
Dig down deep.
Oh, would you look at that?
She looks like a toothpick.
Just look at it.
So, like I said, badges have to be worn. For care at home, you guys know our dress code, our scrub tops that we provide, navy, teal, or white pants, closed-toe shoe, no flip-flops. We had one written complaint of somebody wearing flip-flops into the home. And their pants were too long. They didn't like their long pants, but anyway.
Can't help it, I'm so short, I'd buy the short length.
Yeah, well, short people like that.
I wish I had.
I thought it was
short legs.
It's not there?
These are the short length.
These are long.
I know, I picked that. Okay.
I wear spandex under my scrub pants so I don't have to pull my
In the summer, ladies, you guys all know capris are acceptable, but you cannot wear flip-flops. So I don't care if it's a Croc or whatever, it has to be a closed-toed shoe. Make sure it's suitable. Yeah, Crocs.
As long as I don't have soggy socks, I don't care.
Well, yeah. I usually get more water myself. So everybody, we have a mission and a vision statement. Every company has a mission and vision statement. I don't expect anybody to memorize it on our website. It's also in our policy and procedure. But that's also another question that they will ask that we have to prepare for to make sure that everybody knows the mission and vision or where to find it. Conflict of interest, performance reviews. I'm just going to run through my notes real quick and make sure. Do you have anything to add, Stacy? We have to review. We review contracts, so we reviewed your contract in January with the governing body.
If I know the answer to this, I can't think of it. What are we doing about reading the rights and responsibilities for the patient that doesn't have a second visit in the 4 days?
The next skilled visit.
Okay, that's what I
It
thought.
has to be done. We have to mail the stuff within 4 days, but it's the next skilled visit.
Okay.
So the first visit is your admission. Whoever is the next skilled person to go, whether it's PT, OT, or another nurse, has to be done again.
I thought you said
Yeah.
the next visit within the 4 days.
I might have.
so-
The mailing has to be within
Okay.
4 days. Sorry. Okay, so our visit,
I
yeah.
screwed
We
up a
have
whole
through
bunch of
April to have our visit done, so like I said, this is March. I was hoping she wasn't going to be here before we had this meeting. Do you guys have any questions about anything that we went over?
I've told all the home health aides and nurses should be doing it also. Back on the do you know how to contact the office or your nurse, make sure you're asking your patients every visit if they know how to get a hold of.
And it shouldn't be the nurse's home cell phone number. It should be the office number. If they say, oh yeah, I have Carolyn's number. No, do you know how to get a hold of the office? You know, because what if Carolyn is out of the country for 2 weeks and then they try to call Carolyn? So,
See elephants.
I won't go see elephants.
so in one of the 484.60A on one of their POCs, it's talking about the specific measurable outcomes and goals. So make sure when we're talking about charting, you're doing measurable outcomes and goals. So measurable either with distance walking without being short of breath, how far they can walk before they have to stop. Nurses, same thing. You need to make sure it's measurable outcomes and goals. So that they're going to set up their own meds, that they're going to be able to do this by whatever date, wound's going to be healed by this date. It has to be measurable. You guys need to be charting it. I don't care if you got there and they were drinking tea at 2. I don't care. I don't want it in the charting. All I want is pertinent information regarding the patient's chart and their plan of care. That's it. If there's a safety,
What if it's vodka?
Are they able to walk safely?
No.
Well, then you might want to chart it. If they're you or them. Yeah. So if there's a safety issue, it needs to be charted. If you get there and there's electrical cords across the floor, you need to be charting that you educated that. The only bad thing with our charting and your charting is you can't see ours. We can see yours, but you guys can't see ours. So if you guys ever have questions, please pick up the phone, call the case managers, call the office, talk to Stacy, talk to myself. We'll answer any questions we can about the patient and help you out with that. But until you guys are ready to come chart on our system, that's what you're going to have to do. Heather tells me no.
It's not gonna happen.
Why? Because I have 6 agencies with different systems.
Yeah.
Not
Yeah,
gonna
but we're
happen.
the most important.
We're the
coolest
I was gonna
people.
say, wait a minute.
So the other thing on your guys' plans of cares, I know on our side we've already talked about it. Do you have patient-specific interventions and education on your plans of care? Is it patient wants to be able to ambulate to the mailbox, patient states they want to, it can't just be your generic check boxes anymore, or you're in trouble. So it has to be patient specified, and it has to be patient's goals, not the standard plan of care that you can type out in 10 minutes by clicking all these boxes. They want to know what the patient wants to be able to do.
They have, our goals are set up where they give like 5 general goals, but then you can write out your own goal, and each of those general goals have blanks and open boxes where they can free text, walk 100 feet to go to the mailbox.
So those blank boxes need to be filled in, so every patient has a little bit different individualized care plan to make sure that we are following all the COPs correctly. If you have a caregiver or family in the home that you have talked to them about helping with exercises, helping with medications, helping with bathing, and they refuse, document it. Because if they have help in the home, like on the Oasis on the admit, Uncle Fred said he was going to help, but come day 3, Uncle Fred's like, I'm done, I'm not helping anymore. So on the Oasis it says he has help. So that means all the way through the charting, if there's nobody that says family that refuses to help, they're going to deem a lot of our charting or a lot of our visits as unnecessary because he had help. But nobody bothered to chart that they're not willing to help anymore. So if that changes, you just need to make sure you document it. And you might not know that, but if you have family or whatever there that are refusing to help, make sure you're documenting it. Anytime you guys have a patient report to you that they have fallen, that needs to go to the case manager so they can fill out the incident report and report the fall. So I don't know how you guys report it. You report it to Heather.
That should already been a given.
Yeah.
They're supposed
Right.
to call the nurses.
Right.
They
But
don't have to tell me, they just
our
call
home
the
health
nurses.
aides don't have to fill it out either. They have to report it to the case manager. Case manager has to fill out the incident report. I have to review the incident reports. So just make sure that those are getting reported. Any kind of fall, any kind of...
I thought if they were present during the fall, we have them do.
Right. Heather. Yeah, we just do a
Okay.
If you guys do a communication note because they did whatever, we can just copy and paste it into our system under therapy. But yeah, so I think we've had a couple that you guys have filled out incident reports during the visit. Is there just one? But we just pull it over to our side. They want to make sure on your charting that you're involving the patient or the caregiver. And like I said, if they're refusing, document they're refusing. If they're helping, document that they're helping. And a lot of this is just more documentation. Our coordination of cares, so the biggest thing is for HTS is you guys give the information to Heather when we have case conferences come up. Thank you. You guys are very prompt at getting that back to her. So our nurses are supposed to be utilizing that in their case conference note and discussing how your patients are progressing. So that's how we document our case coordination as our case conference notes. We get the information from you guys, how our patients are doing. They're supposed to be getting the information from the home health aides, and as well as what they collect, collaborate it into one. We used to have actually sit-down meetings every Tuesday, but it got really taxing to get everybody here at the same time. So we stopped doing that, and it's all just via email.
Email and stuff.
Yep. This is like 7 videos, 8 videos long of information I'm trying to compile into an hour for you.
Who did the sign-in sheet stuff?
Chelsea's holding it.
Okay. Okay. On your plan of care, the nurses, we have like the automatic boxes where it talks about their risk factors for ER visits or readmissions. Not so much for therapy. That's more for our side. Any orders, you guys don't get a whole lot of, you don't write very many orders. But if you guys do write an order, you now have to have either per faxed order, they have to be timed and dated. Like received on this date at this time from whoever. It can't just be your signature at the bottom. You have to have it written out in your order.
Yeah, we don't do, like, we can't actually take an order from a doctor. It has to be the nurse, but
Right.
we don't
Okay.
do any of that.
These guys should remember that.
But that's sent from our val to the nurses, isn't
The
it?
whole plan of care is the order.
Yeah.
There's no separate order.
We send your whole plan of care to the doctor and they sign the
Sometimes it's
last
got
sheet.
Equipment in that.
Right.
If it's an equipment order, it does go to the nurses, but the nurses have to call the doctor and get an order from the doctor anyways, so it goes through them.
Okay, so another thing that surveyors are they're gonna ask the patients, how they were informed and by who of their patient rights, so that's that rights and responsibilities. So, and again, some of them are gonna say, I wasn't informed, even though they are, but anyway, just try to remind them that those rights and responsibilities are in there. If you change the plan of care, or when you update the plan of care, when you guys do your reassessments, those also have to go to the home. And like I said, Steph, you're still printing off all the reassessments and plans of cares. We're trying to get them there, but if you guys have other things, or if you notice it's not there, let us know so we can get it there. But if it does change, you have to make sure that you're telling your patient that it's changed. Inside that folder also there's there's probably like a 4-page list of community resources in that patient's area, so in case they need help with whatever, they can always refer to that plan, that list as well. That's something else that has to be in that folder. Complaints. Anybody have any other questions? I have individualized written across everything on here, so just make sure your plans of care, like I said, are individualized, or whatever. Even if the patient says they want to be able to go to their daughter's wedding in 3 months and they want to be able to walk to that, just whatever they're telling you they want to do, just make it individualized.
And that kind of goes along with that skilled statement that I've told you. Their patient requires skilled such and such therapy. Why? For what functional reason? That functional can't be to meet highest level of function to be independent. That can't be it. It has to be so that they can, that's like that go to the mailbox, or be able to return to gardening, or be able to whatever. It can't be the same thing for each patient. It has to be a functional reason, functional thing that their goal is, and that's why they need the skilled services.
Do you have anything else, Dad? I think that is pretty much it in a nutshell. If you guys have any questions later, let me know. But just remember, like I said, when she's here, or he, I'm assuming it's going to be Mary again, they're going to be in our conference room. Not that you guys come in a lot, Heather does. All care at home people, badges have to be on, dress code has to be in place. Get your charting done within 48 hours. You guys are usually pretty good at getting it done that day. Even your return stuff, make sure you're getting it. If you get here and you have 4 charts due and you have 6 returned, get those knocked out and get them sent back, because like I said, those are all timed and monitored. Nurses, make sure your notes are getting turned in every day. Oasises have to be done within 2 days, period. No excuse. Starts of cares, I'll give you 3 days. And then, because that doesn't give Stacy time to get it back, and get the plans of cares changed before you have to write an additional correction order. So, any other questions?
I have a question.
Yeah.
If we don't have to take things in one bag, if I have a pulse ox in my pocket and the blood pressure thing in this pocket, do we still, how do we do the barrier thing?
Do you have wipes to clean them with?
In my car. You have to take them. Okay.
I
For my finger one, I've got the little square alcohol things.
Yeah,
Your best bet with surveys, don't take exercise equipment in if there's going to be a surveyor there.
Yeah.
And really, if there's not for therapy-wise, if there's not a real medical necessity to check that stuff, don't take it in for the survey part. Less is best.
I agree.
But still wash your hands. Walk in the door, say hi, and go wash your hands.
Yeah.
And before you leave, wash your hands again.
Or use hand sanitizer?
Yep.
Yes.
Yep. Either one. Yeah, but hand washing is a huge one. Bag technique is a big one. We were missing a few physician's orders. Our write-ups were really, they dug to find 5, but I was still not happy, and 5 was my goal this time.
Might have gone 4 if I didn't argue with
We
it.
would have got 4 if Stacy would have kept her mouth shut. So.
That's a given.
But, yeah.
I only argue if I know I'm right, and I knew I was right. She wasn't like it.
You have to clean the surface before you
I
can
was
set it
not
down.
wrong.
No, she was
So
wrong.
as long as we do that, we don't have to have.
Right. Yep. As long as it's a hard surface. Yeah. Yep. Yep, but if you're gonna sit it on like a cloth chair, then you have to have a barrier between whatever you're putting down and your clean stuff.
And I will work those on.
Newspaper, do you have to bring your own newspaper?
Unless you know the people, well, I'd probably have something to take in with you, otherwise you'd have to go digging around their house for a newspaper and.
And I will work on getting some of those wipes for everybody.
I've got stuff.
Sam's Club.
I just leave it in my car, I don't take it in.
Bleach wipes go.
I don't think it's gonna check your wipes as long as there's disinfectant.
It says bleach wipes on the outside.
I think most of our bad houses, we have stuff in the home if it's needed.
Okay.
Um,
Did you guys hear that? If it's for their houses wise, if it's a bad house, they have usually stuff they leave there, cleaning things.
I would rather eat the cost and leave equipment in a house than take that to house to house to house. So a lot of our houses that are,
If they're houses, we know that you should be taking bags in.
we have supplies. in
We
them.
have supplies in the homes. I guess we'll just have to let Heather know.
Yeah.
It
Well,
counts.
you guys mostly know if there's cockroaches, bed bugs, or
Well, I'm
mice.
not going into the first time.
We don't know
I'm
anything.
saying.
I swear, we don't know anything.
Is there a way to
We don't see
communicate that?
nurses' notes.
Yeah, when you guys send out a message about a home, make sure Heather's attached to it, and then she can forward it on.
Or just type it right on that referral.
And a lot of ours are some that we've had for a while that you guys wouldn't be seeing, so.
So what do the antibacterial wipes, or what is it that
Disinfectant, it
has to say
yeah.
disinfectant on
Yeah,
it?
it should be a commercial grade.
I was gonna try to get some Clorox wipes.
Yeah.
I always get those.
But like I said, they aren't gonna, what, Patty?
I thought you said that we couldn't use those.
You guys are not going to, but if they choose to, you use the wipes I supply you.
Yeah, those Lysol,
Yep.
we can't use.
No, no, so. And I can give you cases of those. I don't know what
They're not strong enough.
Yeah. But like I said, the surveyors aren't gonna spend a whole lot of time with you guys, but they're gonna come in and talk to the patients. And whether they do come with you, they're supposed to go with every service offered. So they're gonna go with at least one PT and one OT.
But we will have a heads up.
Yeah, you'll have a heads up, like, well, that day, probably.
We'll know when she comes in. She's gonna give us a list and wanna know.
Yeah.
You could have
Well, last year I was texting and driving.
Don't worry.
I was going to,
I'll
you know,
give
send
you
this
all a
out, but-
text. What did we do last year?
mass text.
Mass text.
Yeah, but
And
if,
we
what
got,
did
like,
we
code
say
words?
though?
If you do,